regional mental health units, which were the government built around the country before that opened up. But that's what mental health clinics were like back in 2006. And in the country, there was just one child psychiatrist. In Uganda, between nurses and doctors are a group of people called psychiatric clinical officers, and they can prescribe and treat. So they're the backbone of mental health care in Uganda. But the children would have to go into an adult ward when they needed to go into hospital. But they did have a clinic for children in the big outpatient department full of adults in Butabika Hospital at that time. What we found when we first went there from this link and began to hook up and develop the relationships we have done with our colleagues there was that in those days 90% of children and adolescents who came to the outpatient departments had epilepsy. In England, epilepsy is much rarer and it's treated by paediatricians, so it's not normally part of mental health services unless a child with epilepsy has another problem. So the problem was they weren't seeing any, and obviously children had really been harmed by, so there was a lot of bereavement and also a lot of abuse of children, not just in that area but all around the country. And the problem with it was that epilepsy, as it was in England when I was growing up, was considered that people were possessed, that it was the work of magic and other kind of witchcraft, other things, rather than actually accepting that it was a disorder of the brain, which you'll see from the film. Early pictures, these pictures are from our trust early photography, and so we're allowed to show the patients' faces here. They're very old pictures now, actually, when we first started to get involved with the ward. So what we did after that time with our colleagues at Butabika was we started to train groups of staff, first at Butabika, then in Mbarara, and then a group of clinical officers that I was telling you about who would come together once a year around the country. And then we developed this ward for children in Butabika, because when I first went there in 2006, we had to go and find children on adult wards, and there were about 20 of them, but nobody really, they were just lost. They'd never been assessed, and they were wearing the same uniforms, which is that green uniform that the adults were wearing. So we developed a way of taking the children each day from the other wards into this big building. We have a lot of space, much less crowded than some of the conditions in this country, and as you'll see, the grounds are very beautiful. And it became a ward where the children could sleep in about 2009, recognised by the government, and the Ministry of Health now has a policy which we launched in 2017. So sorry it's a bit technical, but we just discovered this empty building, and the reason we spotted it was, if you look over on that picture on the right, that's the back of it, there were some slides outside, and we'd been looking to see where these children could go, and they were just too embarrassed to tell us that the hospital had been refurbished and they got a plan to have this children's ward, but it was never opened, and everybody, you know how it was really the elephant in the room, because nobody actually thought, and lots of beautiful grass to play in. And later on, we had various volunteers there raising funds and doing murals and making it more friendly. And on the right, two very important people. One is with the front person is Irene, who is the in charge nurse now for the children's ward, and she is trained in child mental health on our training program. And we're hoping to bring her over here to do more training in ward management and to the adolescent unit we have in East London next year. And Becky next to her was a church volunteer who got a psychology degree, who, you can see Brenda here, comes from a charity who originally funded her through the church to provide education and play and to support the children's ward. She went on and trained in child mental health, and now she's being supported to continue as a professional on the ward providing treatment. We have another church volunteer. And they're sitting outside the outpatient clinic teaching the families who come about epilepsy, in fact. That's what that picture is doing. Now we've got the video, we can show that to people, and then they can ask questions when they go, and it will save a lot of staff time. To work in Mbarara, working with the psychiatric clinical officer Joseph, who's now up in, anybody from Karamoja? He works up in Karamoja, doing wonderful work there. It's where he's from and his family are, and he left Mbarara because he chose to go back and provide the services up there. So they're seeing a child, and you can see we have drawing materials and play, because that was something very important when we first started seeing children. Children would come, and they'd be, Ugandan children are very well behaved. Something that we could learn a lot for English children. And look at you sitting here so nicely and paying attention. But it was a bit of a problem in the clinic, because they would sit so quietly and nicely, unless they were really out of control and have serious problems, that it was very hard to get the staff to talk to the children. They would always talk to the parents, and using play and drawing is a way of learning about how the child thinks and how they feel. So that's what they're doing there. They're talking to the child, not the parent. And this is working with children in Uganda in 2012. And by 2017 we had 36, which we organised a cake and a leaving party for them when I was lucky enough to happen to be there at the time. There's one of the nurses in the background. This is in the side room of the children's ward. What's covered under the table is the cake and the drinks that they organise. He's a mental attendant, and the ward has more mental attendants who kind of fulfil a caring motherly role, really, which we didn't have. They also provide meals and sometimes do cleaning and various other tasks, but they're actually not qualified professionals. And the lady in the back is what was called an askari. Have you heard that word before? Yeah, probably some of you had. In the hospital, when we first started working there, the askaris would have batons, and they'd be there to control the patients. And it's been a battle to get regular ones working on the children's ward, and who would actually become part of the caring group for the children. And I just came by on the weekend, and I saw both of these staff working with this, playing with this young boy a board game, and it was just such a pleasure to see, really, because 5 years ago we certainly, or even 2 years ago, we probably would not have seen that.
Any quick questions? Epilepsy and kids having sort of mental health problems, what is the correlation between epilepsy? Because I feel like epilepsy is more of a medical problem.
Very good question.
So how's a child having epilepsy sort of affects their mental health ability?
Yeah, it's a big issue in Uganda. In fact, we had a debate on it at one of our conferences, because, as I said, in this country, it's treated as a medical disorder and managed by paediatricians. And in Uganda, it's treated as a psychiatric disorder and managed by psychiatry, by mental health services. It's a brain disorder, and it is a physical disorder. But with it goes a lot of problems as well for some children. The film, which you hope you get to see after I've gone, will show you how this young girl is managing so well with her treatment, because you can get the right medical treatment and follow it through properly. People can lead perfectly normal lives, go to university and all of those things. But unfortunately, epilepsy occurs more often when people have learning problems or autism, or have had a road traffic accident and damaged their brains, and might have other problems. And any chronic illness, but especially for some reason epilepsy, they have many more mental health problems, depression, problems at school. And then there's also the whole issue, which I mentioned, stigma, that people might not let them go to school, and so they miss their education. Sometimes they're rejected, sometimes they're taken to traditional healers and as if they're possessed. So in Uganda, sometimes that can make those problems worse. But there's definitely lots of research that shows that children and adults who have epilepsy may have other mental health problems, and so it's very important to help those as well. And when they were so busy in the past with so many children coming with epilepsy, they weren't picking up the other problems, but now they do much longer assessments and make sure that they do, so that they get some help for the other problems as well.
Has contributed to actually our nation in Uganda, and there's still a lot to do in terms of training the staff, because the diagnosis of autism and learning disabilities is quite a new initiative in Uganda. But well done. This is a big thing. What I wanted to get a glimpse at is how is the referral system coming into, is it a free walk-in for admission? I mean, have you mapped up the referral systems onto admitting children at the ward or on the wards?
I mean, it's a huge challenge. It's
stuff.
still miles from a country village to the hospital to come and get some help, and they just expect to be seen when they arrive. Well, when they know they're going to have to wait. I think that's true from other medical services too. I don't think it's just appointment systems would be very difficult to establish, but because we've actually trained people now in some of the psychological treatments that you'd use, you know, like family therapy or help to manage children's behaviour, then so a member of staff would see this family. They would try and do as much as they can in one interview, but then say, come back to see me on next Tuesday, I'll be there. And so there is more of an appointment system in that way. And the same in the hospital, of course, because Butabika has a large number of children admitted. We have a lot of trainees now working on the hospital wards who are providing and supervised in providing treatments. So if they're in hospital, then you can obviously see them every day if that's what is needed. So, but it's developing around the country, and it was the project we've just run this year was implementing the mental health policy for children. Part of it was people we've trained getting together to support each other in their regions. So we had one in the north and one in the west, and then a central region including Ginger. And they had peer support where they helped each other with difficult cases and therapies, but as well as that, they ran training sessions for their local staff. So they would have about 100 people from their regional hospital and around coming and being trained to understand more about mental health problems, which is really good because some of the mental health problems is a matter of awareness, isn't it?
Yeah, sure.
The problem is we have to hope that the training programme continues and we can keep getting more and more around the country. But we've been encouraged because we've had some Ministry of Health scholarships this year, but it's been a real struggle to keep the training programme going without the funding that was promised.
Well done. So thank you so much for your feedback and your questions around that. Just keeping an eye on time. Next up we have Mehdi Segawa, who's going to talk to us a little bit more about preventative care. So he is a kind of social worker, he's a clinician by background, and he has kind of a lot of different ideas around wellness, and it's going to challenge us to think about things in a slightly different way. Mehdi, I need you to come up here and help yourself set up the technology, because clearly I'm a bit challenged in the technology from today. So thank you so much, Mehdi, for just giving us your next round of talk. So we'll try to, as much as possible, just keep